post-concussive syndrome. What is it and why is it challenging? Is that who people call the miserable minority? Talk a little bit about that.
Post-concussive syndrome by definition is when you have symptoms of concussion lasting longer than 3 months. Because we just said the majority of the population will recover within a 2 to 3 week time period. Now you've got these other individuals that still have problems with their vision. They say it could be anything from headaches to nausea to dizziness to issues with their emotions. All of a sudden they're laughing and then they're crying. So I think that you have to kind of dissect what it is that they're hyper focused on. Because usually it is maybe one particular symptom, but then everything else follows behind it. And a lot of times it snowballs, right? So they have a headache, they're dizzy, they're not sleeping. How do you feel the next day if you haven't slept, you have a headache, and when you get up out of bed, you're dizzy? Now try having that for 6 months, every day. So they're miserable. They are truly miserable. Now, were there things that went undiagnosed, such as a vestibular dysfunction? And when I say vestibular, I mean a balance issue. So there's a reflex between the eye and the back of your brain, and that is kind of what can be, let's say, jarred during any type of injury, even a slip and fall, even a rotational force, or maybe the alignment of your eyes are just so slightly off that you're not able to converge on an object, or you're not able to truly track an object. So in most ERs or even a primary care office, they're not testing your visual pursuit or your convergence, maybe even your balance. When was the last time your primary care doctor had you stand on one leg?
Takes too long.
It's not a knock on them. It's not part of a general physical examination for a health check visit. When I first see a post-concussive patient, I go back to the history. I go back to what was done for evaluation and then what was done for treat. And if there was any imaging in that time frame. And then kind of looking at each symptom individually and seeing how we can address those as well.